Good day, everybody. My name is Stefano Conti from Parma, Italy. And today I'd like to share with you kind of a new concept in achieving aesthetics around implants from another surgical perspective. Today we want to be minimal invasive. Today we want more aesthetics and less invasiveness. So what about the Prama? What about the intramucosal? Well, I'm going to show you what we have been done for so many years. Anytime we're missing bone, we should know how to manage the bone in order to place the implant and to get to the final outcome, right? So we need to know all the techniques we have at our disposal to recreate the volume. And also, even more importantly, we should know how to manipulate the soft tissue. So we can achieve beautiful results. But again, this is a technique-sensitive approach. I'll show you another case I've done 17 years ago. We've been placing in a team, we've been placing the implants in the ideal 3D placement position. But again, we go through a bone regeneration. And of course, we need to know how to do it in order to recreate the volume. But again, is a technique-sensitive approach. So, according to the workflow, we've been through all the steps with the proper timing and design until the final aesthetic solution, right? So it works, but we need skills, we need knowledge. Is a technique-sensitive approach. And what about an implant that is going to help us for specific clinical situation in order to be minimal invasive? And I'll give you an example, a case I've done with a Prama implant. As you can see, we have the loss, the buccal bone is gone completely. So according to the book, we should approach to the case in a completely different way. After the sounding, the mapping of the alveolus, we have 9 millimeters of defect on the buccal. What can we do though? Well, let's see now what we can do by the book. And if you see, we have to work differently. By the book, we should do the side preservation, then place the implant, or side preservation, side development, and then place the implant. But what about now an implant that can really help us in achieving a complete different approach, surgical approach, with a very minimal invasive approach? So we have now the Prama, the short neck, we have the standard neck, and the long neck of the Prama. The long neck is the one I'm going to utilize now in the case. As you can see, it's got a long neck, 3.8 millimeters of UTM surface, which is ideal for bone, but also even more importantly for the soft tissue. So we go through the surgical approach with a very minimal invasive approach. We place the implant. As you can see here, the neck is exposed. And we have to manage the case with the soft tissue, because the neck of the implant is ideal for soft tissue as well. This is what we achieve after the implant placement. The day 0 and then after a few months. Where we have a space maintaining defect, the bone is going to get around the neck of the implant. So we have osseointegration. Where we don't have a space maintaining defect, we have the connective tissue going around the implant. What we achieve is an achievable result, a nice peri-implant tissue without any huge surgical approach, without GBR or other technique to develop the site. So in a way, we're going through a final outcome with a very minimal invasive approach. This is what I like about the Prama. I want to win easy. I want an easy win. This is what we got. We just have to wait for the soft tissue to adapt, to seal the neck of the implant, and to adapt on the landing zone of our emergence profile of the crown. Thank you. And I hope you can join me. If you want to know more about this, please stay tuned.